our research group focuses on two new fields of research: cardio-oncology and cardio-immunology. These are highly interdisciplinary fields of oncology, pharmacology, cardiology, immunology, and obviously molecular medicine. These interdisciplinary fields obviously require highly translational research. Therefore, we collaborate closely with clinicians to obtain valuable human samples, and also we work and develop state-of-the-art new techniques such as RNA in situ hybridization, multiplex fluorescent immunohistochemistries, flow cytometry, laser capture microdissection, or RNA sequencing, just to mention a few. During the last years, we have been interested to understand the pathomechanism of heart failure. This is still a devastating disease affecting a large amount of people with high morbidity and mortality. Heart failure mainly has three different clinical presentations. One is heart failure with reduced ejection fraction. This disease develops mostly years after a patient had a myocardial infarction, and it is characterized by limited physical capacity, edema formation, and difficulty breathing. We were among the first research groups who started to understand and explore how chronic inflammatory conditions contribute to the disease development and to the symptoms. And we explored first whether this can be targeted therapeutically. The second major form is heart failure with preserved ejection fraction. This disease mostly develops in patients who have multiple comorbidities, such as diabetes, obesity, hypercholesterolemia, or hypertension. Due to the complexity of this disease, we still don't really have proper therapeutic options for these patient populations. Therefore, there is a high need for translational research. We are especially interested to study the contribution of liver diseases to this cardiovascular pathology, and therefore we are establishing animal models with liver diseases to study the pathomechanism of cardiac dysfunction development. The third form of cardiac dysfunction and heart failure develops due to side effects of certain drugs. We are interested to study the chemotherapeutic drugs, most specifically immunotherapies that cause cardiac dysfunction. This is an ever-rising issue in cardiovascular medicine, as due to the revolution of these immunotherapies, more and more people are getting these therapies, and therefore more and more are developing these cardiovascular side effects. We are aiming to alleviate the cardiovascular dysfunction, but at the same time, we would like to maintain or even increase the efficacy of these immunotherapies.